Over to you, Glenn.
Fantastic. Thank you very much, Simon. Hi, everyone. We'll just wait a moment or two before we get started to give a chance for a few more people to join. So we'll have that awkward pause where we're just staring at the screen, and then we'll get started. We'll wait a few more moments until we tick over to 12:30, and then we'll start. Oh, my phone says we have ticked over 12:30, so we will start. Good afternoon, everyone. Thank you for giving up your lunch break to join us for what I'm sure will be a really informative webinar. Today, we're focusing on the hot button topic of burnout and patient safety, in particular, how we can manage workforce well-being to improve patient outcomes. If we could just flick over to the next page quickly. Thank you very much. My name is Glen Ferris. I'm the editor-in-chief of Healthcare Today, and I'm joined by Dr. Richard Duggins, who has a lot of things that he's done in his lifetime, but I'm going to try and make it succinct as possible. He's an author, he's an associate medical director, and he's a consultant psychiatrist in medical psychotherapy, and has a particular focus on medical burnout amongst many other roles. If we could just flip to the next page, thank you. As healthcare or healthcare adjacent professionals, will have all seen how rising workloads, chronic staff shortages, and relentless pressure are leaving doctors and clinicians exhausted. This inevitably leads to an increased risk of diagnostic and prescribing errors and a reduction in continuity of care and overall quality of service. Today, we'll ask, what is burnout? What causes it? And offer some practical steps and evidence-based interventions. A little bit of housekeeping. There will be an opportunity to ask questions at the end of the presentation, so please put any queries in the chat box as we go along. In the meantime, let me pass you over to Dr. Richard Duggins.
Thank you so much, Glenn. It's wonderful to be with you all here and have this opportunity to share work that I'm very passionate about, which is about burnout. I've worked in staff support services now for 20 years, so had the privilege of seeing thousands of doctors and other healthcare staff with burnout. And I wonder if you recognise any of these: feeling overwhelmed frequently, decision fatigue, sacrificing personal time for work, working evenings and weekends doing admin, questioning your work-life balance, poor sleep patterns, not being present with patients or family members. What's the reality of being a doctor in 2025? Well, growing patient numbers and waiting lists in the NHS, balancing NHS work and other work and family commitments, and 60% or more of doctors reporting feeling overwhelmed, and some because of this, reducing their hours. And the General Medical Council told us this in their survey in 2024. And many doctors are still trying to do it all alone. And we know burnout levels are rising. 39% of junior doctors reported experiencing burnout to a high or very high degree because of their work. 51% of doctors in training described their work as emotionally exhausting to a high or very high degree. 66% claimed they always felt worn out by the end of the day. And among all doctors, 33% of doctors reported they were struggling. We know as doctors and healthcare staff, we feel like we've run one marathon and then another marathon, and now we're being asked to run yet one more. In the services that I work in and lead, I get the privilege of meeting many staff, and I thought I'd share just two encounters that I had recently. One is from a nurse. She said to me, "I sat in my car outside work that morning trying to force myself to go in. It was then the panic hit. My mind was still willing, but my body had finally said no more. This reminds us that burnout builds up slowly over many months or years, but often it can hit us quite quickly. And this is a doctor who was in my, I run a therapy group for burnout within the NHS in the northeast of England. And this is a doctor in that group. And in the first session of that group, he said, I'm a ping pong ball bouncing between work stress and home pressures, constantly in motion, never stopping or resting, no time to reset, no time for me. So you can see all the emotional drains on his energy and no time for himself, no time for self-care. I'm just going to, over this lunchtime, just ask for a little bit of interaction. Perhaps put the answer in the chat if you can. Who recognised this quote? Where's it from? Just keep swimming. Anyone recognise that? Anyone brave enough to put it in the chat?
I'm happy to jump in. Is it Finding Nemo?
It is. Thanks, Glenn. So this is Finding Nemo. There you go. There's Nemo and Dory. This is terrible wellbeing advice, and I'll come to that later. What about this one? Keep calm and carry on. Anyone want to go at that one?
Don't know if I'm old enough to comment on this one, but I've certainly seen enough placards around. Is it from the Second World War?
Yeah, okay. So not actually using the Second World War, prepared in case we were going to be invaded by the Nazis, so thankfully not needed to be used, but keep calm and carry on. Again, in my opinion, terrible well-being advice. Okay, so this is what we're going to whiz through. There's going to be quite a lot over this half an hour of this presentation. We're going to talk about stress and burnout, what helps stress and burnout, how we support our colleagues, and also importantly, why burnout is bad for business, and in healthcare, why burnout is bad for patient safety. So something I think we can probably all agree on, that doctors and health professionals are remarkable. They work hard in their training, they gain high levels of qualifications, they're passionate, they're driven, and they meet patient challenges most days. And this requires a great deal of emotional labor and technical skills. And perhaps what's most remarkable about doctors and health professionals is they get up the very next day and they do the same thing again. But what's also remarkable about doctors and health professionals is the high levels of burnout. And I've given you some figures already, but if we look at this, we've got 3 in 4 healthcare staff experiencing burnout or poor mental health at work in the last year. That's what surveys are suggesting. In the last year, 30% of healthcare staff have taken time off due to burnout or poor mental health. That's just in the last year. And if we look at doctors, current figures suggest 30 to 50% are currently burnt out. 20% of doctors are depressed. Our risk of depression goes up 7 times when we start working as a doctor. 7 times. Anxiety rates are 25% in doctors. Alcohol problems are high. And in female doctors, very sadly, suicide rates are 3 to 5 times that of the general population. So doctors and health professionals are remarkable, but they're also remarkable in their levels of burnout and mental health at work. Probably in the UK, the most burnt out profession. Just going to show you a few diagrams here that help for me capture what burnout is and also what it isn't. So this is the Yerkes-Dodson curve. This shows how our performance is affected by stress. The Yerkes-Dodson curve's over 100 years old. I was shown it in my second week of medical school. Didn't mean much to me then, but means a lot now. Usually when people show the Yerkes-Dodson curve, they say a little bit of stress is good for us. It helps us key up for things like, you know, certain procedures or presentations or interviews. Yeah, that's true. But in the NHS, we're not dealing with a little bit of stress. What we're dealing with now is lots of stress that's sustained, that is day in, day out. And that means a lot of us, 30 to 50% of doctors, are now in that distress side of the curve. Notice our performance levels are going down. And what I see when I meet people in my clinics is they tell me a similar pattern of how their burnout or anxiety or depression developed at work. And it usually starts on a spectrum as a continuum with problem stress. Problem stress, different for different people. I'd encourage you all at some time this week to sit down and write down what your symptoms of problem stress are if you don't know them. But typically, they're things like irritability, fatigue, our sleep going off, muscle ache, withdrawal from social contact. They're problem stress symptoms. We'll probably all get those at some stage during the year. But what's the problem is if stress remains high and sustained, then we're going to move on. We move on to compassion fatigue. This is not caring about our patients and our colleagues in the way that we normally do. We find empathy more difficult. We become more robotic, more cynical. This is compassion fatigue. Very upsetting for health professionals and doctors. If stress remains high on us and sustained, then we move into burnout. I'm going to say a lot more about that. Burnout, again, is a continuum, mild, moderate to severe. If we're in severe burnout for too long, stress remains high on us, then we stand high risk of moving into what we traditionally call a medical diagnosis, like anxiety or depression, or actually physical health problems like hypertension. So that's the pattern of the way that these things develop. But what is burnout? Burnout is simply doing too much for too long with too little support. It's a straightforward thing. It can be defined, and the gold standard definition for burnout is from a professor on the west coast of America called Christina Maslach. And she says burnout's three things: emotional exhaustion, emotional distancing, and loss and joy at work. And I tend to think those one of those follows the other one and then follows the other one. So because we're doing too much for too long with too little support, we become exhausted. At the end of the day, flop on the sofa, no time for family, no time for social life. We're exhausted. And because we're exhausted, we protect ourselves by distancing ourselves emotionally from our patients and our colleagues. So, like compassion fatigue, we become less empathic, more robotic, more cynical at work. So we just kind of go through our clinics without really engaging with the people we're seeing emotionally. And then because we're like that, because we're not engaging in our work in an emotional way, we lose the joy in our work. We lose the very things that took us into this in the first place, those sense of small wins and pleasures. So they're the three things. If you've got those most days for several weeks, you're probably burnt out. The picture there, the black and white picture, is to remind us that actually where the word burnout comes from, which I think it's really useful to remember this. So this is on the east coast of America in the 1960s. There was a psychoanalyst called Herbert Freudenberger who suffered burnout. But he said, what is this? What is this strange thing I've got? I haven't got a word for it. And he was walking around New York and he saw fire-damaged buildings. And he said, I feel like that fire-damaged building. If you look at me on the outside, I look okay, but inside I feel destroyed. And that's what burnout is. People often look okay, but inside they certainly do not feel okay. They feel terrible. It's certainly not to be underestimated, burnout. I'm now going to be brave and talk about resilience. Rightly hated, I think, in healthcare now. Because it's been misused. It's been misused as an argument to whatever happens to us, we just need to suck it up. We need to ignore those problems. People see it as victim blaming, as if we are the problem. I met a surgeon recently who reached out to managers after struggling with months and months of overwhelming demands. And she was simply told to put her big girl pants on. That is an abuse of the idea of resilience. True resilience occurs between people rather than within people. It's a property of the system we work in. It's not a personal characteristic, it's not a weakness, and it's not a failing. It's due to what's happening to us and around us. And that's resilience. And the way to think about resilience really helpfully and get a sense of it is this model by a West Coast psychiatrist called Prof. Laura Dunn. And she says simply, that there are drains in our lives, things that drain our emotional energy, and there are radiators in our lives, things that radiate emotional energy. If the radiators are greater than the drains, we will be feeling resilient. We will be thriving at work. But if the drains are higher than the radiators, we will be feeling burnt out and will be becoming increasingly burnt out. So what are these drains? What are these things that will push us towards burnout? They are work stress, hours worked, intensity of the hours worked, the nature of that work. They are home pressures, everyday home pressures, but also the big things that happen at home to all of us, changes, disputes, and bereavements. And they are also our negative work experiences. And this is where culture and leadership come in because they define these. So, what is it like to work where we work? What is our team like? What is our organization like? Does it feel fair? Does it feel compassionate? Are there so many stones in our shoe that it's really hard to get the work done? These are the negative work experiences. The radiators are the things that protect us from burnout, the things that help us thrive, and you want to maximize these. These are our support team. We're doubly blessed if we have support at work through our colleagues and our line management and support at home. Fun and social time. Do we have fun and social time at work? Most people look at me blankly when I ask them that. But also, do we have fun and social time outside work? This involves us managing our hours so we can do that. And finally, stimulating work. This is a radiator. Is there a particular part of your week you really enjoy? It might be developmental, it might be doing a clinic, it might be doing a list that you really enjoy. That's a really important radiator in your week. It helps you keep going. So it's that balance of those drains and radiators is how we become resilient and, of course, how we avoid burnout. So basically, we become burnt out, not because of who we are, but because of what happens to us. And that is what I see all the time in my clinics, in the thousands of people I've seen over the last 20 years, the tens of thousands of conversations. This diagram here is the diagram I'm best known for. This is called the burnout cliff. And this is how our performance at work varies over time. And this, I drew this after about 3 years of working in staff support services. People came in, told me different stories, different histories, but the themes were the same. People tend to come into staff support services when they hit the cliff. So this is when their performance at work goes down rapidly and they often need to take ill health leave or they need to reduce their commitments at work. Think of that nurse at the beginning who said, I suddenly parked in the car park and I panicked and I couldn't go into work, even though I wanted to. That's sometimes how the cliff hits. It can hit very suddenly. People can over a time of days or even hours. But before the cliff is the plateau. And when you take histories from people who present to you at the cliff, when they're burnt out, they say this actually has been going on, now I look on it, for months, if not years. I've been under increasing pressure and demand for months, if not years. And that's the plateau. The recovery is, these are people who come through to help, and actually most people recover much quicker than they expected. They do really well. International, national evidence shows that in doctors and health professionals. It's really worth coming through to help if you can. Burnout is not a career ender in any way. But let me tell you what's going on the plateau, because that's the important bit. Why are these very clever doctors and health professionals sleepwalking towards the cliff? Why are they sleepwalking towards burnout over months or possibly years? And what happens are two things here on the plateau. The first thing is the way we deal with stress. So the way we deal with stress is that keep on swimming, that keep calm and carry on. And the problem with that is we don't attend to the cause of our burnout. We just put our heads down and carry on. And that's a sure way of going towards the cliff. The second thing that happens on the plateau is people feel ashamed. They feel I'm struggling because this is my fault. This is a weakness. I'm letting my team down. And therefore they don't reach out for help because they feel embarrassed and ashamed. And actually, unless you reach out, unless you flag it up and do something about it, things don't change. And then you can end up heading towards the cliff. This is another way of knowing what's going on the plateau over those months or years. And this is a model by a Swedish burnout researcher called Marie Ausberg. And what Marie says is that we are well if our work chores, which is like family commitments, rest and play, are in balance. But as we become increasingly exhausted and burnt out on the plateau, what we do as professionals is we say, what are our must-dos? And for professionals, the must-dos are often work and chores and rest. So we give up the play. We give up those things that are radiators and actually keep us well. We stop our fun and social times. And then we start our way down this exhaustion funnel, as it's called. And then we just got work, chores, and rest. And then because we've given up radiators, we get sucked further down and we just have work and chores because we're often overworking or our sleep's going off by now. And then in the end, we just have work. We've borrowed all of our performance into work. We're letting family down. We're letting our social life down. And when we've just got work for company, we're near the bottom of that exertion funnel, and we really then are risking the burnout cliff. So what gets us well? I'm now going to talk about what gets us well. I'm going to talk about 5 things briefly, and this is what I see in my clinics helps people get well. The first thing is the suitcase, and this is that people address their basic needs. So if they're burning out because they're working too many hours, their intensity of their hours is too high, they haven't got enough support, they're not taking their annual leave, they're not getting any study leave, they address it. You can get well by taking time off without addressing those, but the danger is you won't stay well very long when you go back to work in the same conditions. You'll burn out again. Basic needs, really important. Next one is the running man. This is decompression activities. The idea is that burnout builds up on us every day, so we need to do some decompression activities to reduce burnout regularly. They must be regular. Decompression activities, once again, are different for different people. Find out what works for you or what used to work for you and try it again. So this might be, for me, it's running, for me, it's cycling, but it could be choir, it could be going to the gym, it could be something like that, or it could be something quiet, something called, with a lovely name of a restorative niche. So this could be reading, mindfulness, knitting, um, cooking, jam making, those sort of things are also decompression activities. But the key is do them regularly. Speech bubbles is social network. This really protects us from burnout. Finding your people with your values at work and at home keep us well. And I see people recovering, reaching out and making much more connections. Next one's got a line through it, which is when we're irritable, can't sleep, we're really careful that we're not adding to our problems by drinking too much. A little bit's okay, but too much is a problem. And the final thing people do, the 5th thing people do, is rather than do what they normally do to deal with stress and problems of keeping calm and carrying on, they do something different. They keep calm and nip it in the bud. They recognize those signs of stress, those signs of burnout, and say, right, I'm going to do something about it. I'm going to try and see whether I can balance those radiators and those drains and do something about it. And what I'd suggest to you is this is how people recover from burnout. But actually, if we can spot our early signs of problem, stress, and burnout and do it while we're on the cliff, we don't need to do it while we're on the plateau. We don't need to hit the cliff at all. So what we can do is build a bridge across this cliff, and we can actually be burnout free as much as possible. So what we need to do is pick up our early signs of problem, stress, and burnout, and actually make those changes around basic needs, decompression activities, connecting with people, not drinking too much, and doing something about it. Just going to talk now briefly about how we support our colleagues. So we know burnout is really common. So how do we support a colleague if we're worried about burnout? So not necessarily our burnout, but if we see a colleague. And I use the WHO's psychological first aid principles here of look, listen, and link. First thing is to look for it, but as health professionals, especially doctors, we're all really good at the game face, so we're probably not going to show it. Remember that burnt out building looks fine on the outside. So let's look for behavioral changes. Let's look for the colleague who is more sociable, becomes more withdrawn, stops coming into the staff room or whatever. Let's look for the colleague who's quite easygoing, who becomes more irritable. Let's look for the colleague who's overworking. Overwork can be a key sign of burnout because we try and keep our performance going. That's what matters to us. Look for those. If you see them, I'd encourage you to be brave and ask, how are you? You'll initially get, I'm fine, but it's okay to ask again. And actually, if you ask again and you find the right place, people will say. And then if people start to say, your job then is only to listen, really. And listening in itself can help people move from that keep calm to carry on to keep calm and nip it in the bud. Do something about it. And a lot of people come through to my services because somebody has asked them how they are, and that's made them think, actually, maybe I need to deal with this. The final thing you can do is, once you've listened, if you think they might need some more support, is to link them to those sources of support. So know what they are. There's lots of sources of support around for health professionals. For all health professionals, there's a variety of things. There'll be things within your organisation. There may be things within your region. So I work in the north east of England and North Cumbria, and we've got the staff mental health and wellbeing hub, which all staff can self-refer to. We'll return your call within a day and we'll see you within a week, and we'll offer you treatment and support. They're great. Not every region has got that, but yours might. Cambridge has got another really good service. There's some charities that you can also use things. As doctors, I put a list there that you might be interested in. The key one I would say is NHS Practitioner Health. This is an outstanding national support service. I also do work in here, so I've got a bit biased, but it's really good with fantastic outcomes. We'll see people confidentially very quickly for if you've got burnout, mental health, or an addiction issue. Okay. So we'll move on to the final bit, last 5 minutes, which is talking about safer care. So this is about how our organizations are affected by burnout. Simply, burnout is bad for business. It's bad for safe patient care. And an organization thrives when its staff thrive. And we know from the research, thriving employees improve an organization's productivity, safety, and customer satisfaction. They also release an outstanding return on investment due to reduced waste on staff turnover, absenteeism, and presenteeism. Presenteeism is being at work but underperforming due to burnout or mental ill health. The average return on investment is probably about 5 to 1, a saving of £5 for every £1 invested. There are high levels of staff burnout, and they mean higher ill health absence, more presenteeism, less productivity, more frequent incidents, more complaints, less profits, and it's more difficult to recruit. And all of those statements are evidence-based. And I think for organizations, the stakes are high. I think they need to be much more worried about this than they are. Because if we've got high levels of burnout, we've got sick staff. We've got staff who are off work, but also at work and underperforming. We've got sick teams. We know burnout is contagious. It cascades through teams. Once we've got a number of sick staff and a number of staff are underperforming, that puts pressure on the other staff, and you get those staff going off ill or underperforming. It produces sick patients. We know burnout is correlated with poorer communication, with poorer teamwork, with poorer making of decisions. Many healthcare staff are making safety critical decisions, and burnout is related to more errors, including medicine errors. That's sicker patients, that's harmed patients. Sick finances. The biggest avoidable waste of money that our organizations currently make is on burnout related and mental health related staff turnover, presenteeism, and ill health absence, and also the costs due to complaints and investigations related to burnout and mental health at work. And I think if we've got sick staff, sick teams, sick patients, sick finances, and sick organizations, sick finances, we have to question, is the organization sick? And is it possible that high levels of burnout are a sign of a failing organization? Or should we be monitoring these as a sign of whether our organization is doing well? We know what a uh, organization that is struggling looks like, but how do we create a healthy organization, one where burnout levels are low? And I think there's three things that we need to do. We need to prevent, detect, and act. Prevention is all about the culture and leadership. We know from the Francis report, the board set the tone for the organization. If the board are not treating staff well-being as a meaningful priority for the organization, we know the staff are less likely to thrive in that organization. Leadership is important, both the execs, but also the line managers. But we know from research the line managers in healthcare are some of the most stressed members of our healthcare team. So how do we support them so they can support the people they line manage well enough so they can deliver good care? Our workplace is important. So is our workplace fit for purpose and the teams fit for purpose? And also, do we have teams which are supportive, psychologically safe, fair, and have reflective spaces to support the emotional impact of the work? The second thing is detection. We need to be much better at picking up the early signs of burnout and treating it early. Much easier to pick it up early before our staff hit the cliff and disrupt everything themselves and the organization. We need psychologically savvy managers who don't wait for staff to reach out to them, but reach in and are kind of monitoring their staff for burnout. And we also need to act. So if we pick up burnout early, how do we manage it? Do we have great occupational health services? And do we have great mental health and support services like we do in some parts of the country, including my area in the northeast of England? But it all does start at the top. And I'd say culture eats well-being strategy for breakfast. It's very hard to do anything if the execs and the board are not seeing this as a priority. Therefore, I would ask, given that we know well-being is so important for patient safety and effective organizations, it may seem paradoxical, but should staff well-being be every organization's number one priority? So I've covered staff stress and burnout, what helps, supporting colleagues, and burnout is bad for business. There's a picture of my book there if you want to read more about these things. Please do. Please feel welcome to have a look at that. It's also on Audible. And finally, a summary. Emotional exhaustion, emotional distancing, and loss of joy in work. Can you recognize the signs of burnout? Also, we might look for irritability, withdrawal, overwork, difficulty making decisions, and compassion fatigue. And I'd urge you, don't keep calm and carry on. Keep calm and nip it in the bud. Do something about it if you're starting to struggle with problem, stress, or burnout. And I'd suggest the first thing to do is look at your radiators and drains and balance them. But if necessary, do reach out for support and encourage others to do the same. Help your colleagues do it, because recoveries are great. Burnout is nowhere near a career ender. And finally, I'd say being a doctor in 2025 is different to 22-year-olds. We need to adjust as staff, and our organisations also need to adjust. Thank you very much for that. And I'm now going to hand back to Glen.
Richard, thank you so much for that. That was very, very informative. As we said at the start of the webinar, if you have any questions, please do pop them in the chat and we'll very happily read them out. I've got a few questions of my own, so you're not getting entirely off the hook quite so quickly. Obviously, there's a lot more people willing to talk about mental health issues, burnout in general, but within the healthcare fields, do you see there's a rise in people willing to talk about burnout and in particular themselves, or is it still generally a case because of the pressures? The majority are just like keeping their head down because that's the job and that's what you got to do.
Yeah, there's so much in that question. I think people are still when people in healthcare especially doctors and senior healthcare professionals, start to struggle, shame is still a big part of it. So
Mm.
people don't want to let their team down. And they do think it must be something I've done, it must be something I'm not doing right. And that is really, that's one of the reasons I do these presentations, because people don't burn out because of them. They burn out because there's something changed in those radiators and drains around them. And if people can feel that, I think they're much more comfortable to reach out. I think it depends what organization you work in, and it depends on what culture you work in. So some places will stigmatize reaching out for help and support, and some are very much, well, this is a really high risk activity. You are likely to run this risk, and therefore, if it happens, let's get you support. I remember in the early days, I worked in a service which saw very few surgeons. And I couldn't work out why we saw so few surgeons. But then we saw a senior surgeon came through, made a great recovery, and went back and told his colleagues, "Look, I've been through to this service. I was unwell. I'm now making a great recovery." And then from that time on, we had no trouble seeing surgeons in that service. He's probably saved people's lives by doing that. And if you've got those role models who say it's okay to do that, that's really important. So if we've got trainees, I think we do need to role model looking after ourselves, but also it's okay to get support. Well, let's start. Is that okay,
So
Glenn?
that's fantastic. We have a very good question from Habib here, which is actually one of the ones that I was going to ask about myself. Asking, there's been seen a what's just popped off here. I'll try and remember what it was. It's gone missing. Sorry. There's seen a rise in junior doctors, resident doctors, as we are supposed to call them now, suffering burnouts. Do you see? Well, first of all, can anything be done to help specifically that sector? And I guess my add-on is: do you see a kind of correlation between age and experience and burnout, or is there no real indicator?
Okay. Um, so what we have seen is a massive increase in burnout rates. So so burnout was increasing prior to the pandemic. It absolutely shot up in the pandemic. So if you think about a service like NHS Practitioner Health, I think it's seeing 3 to 4 times as many people post-pandemic as it was pre-pandemic. But what happened with burnout is it shot up during the pandemic, but it stayed stubbornly high. It hasn't gone down again. And that's the kind of the worrying thing. People thought it would go down again, but it hasn't. So yes, burnout levels are much higher and they've stayed high. It is actually across all of the ages. So yes, we are seeing it with junior doctors, and there are practical things around workload and support that we can do for junior doctors and desperately need doing. And I think helping them feel valued is really important as well. Um, but actually we're seeing it along around all ages. And one of the things that we have seen in the national service is a number of people who are relatively senior presenting with burnout and mental health at work for the first time. And what we consider is that is just a level of the increasing pressures within the system. So people have worked 20, 30 years, not had any trouble, and yet now they're finding it, and it's because of those increased pressures within the system, I think.
Mhm. I have a question here from Robin. Robin, while I understand the metrics, how will it help organizations improve? How do you persuade the board to give burnout a higher level of attention?
Yeah. Well, it's a challenge. It's and I think boards know how important their staff being well is. I mean, I think they know that, but they have so many other must-dos that come in that I think it can get lost, because it's a long-term thing. But but yes, it's hard, isn't it? Because if you just look at the metrics, they make absolute sense. I mean, there was a recent report from Deloitte, and if you just read through that, you're like, well, we're not, these not addressing burnout is is affecting our safety, it's affecting our productivity, it's affecting our reputation, but it's also massively affecting our finances.
Mm.
And that could be money that could be spent on much better things related to patient care and patient safety. Um, So it's I think it's a really good question because rationally it's there. We know there's a return on investment of 5 to 1, but yeah, I don't know. Um, if anyone does know in the chat how we get our boards to take this more, all I think some boards do take it seriously, but some don't, and it's a real puzzle to me because I think it should almost be one of their main concerns. We see, interestingly, in America, if you look at some organizations, and this started in Stanford, on their boards, they have something called the Chief Wellbeing Officer. And this is a member of the board that says any new initiatives, how is this going to affect the well-being of our staff? Because even though this might be a sensible initiative, if it reduces the well-being of our staff, it will reduce productivity and safety and effectiveness. So we need to be really careful about that. And I don't think we've quite got that level of um, vigilance and priority yet in the UK around staff well-being and how they affect our organisations.
I'm going to jump to a question from Elaine here. Can you suggest any studies focusing on patients' experience of burnout, i.e., those on the receiving end of care by stressed out and burnt out healthcare professionals? So the patient experience.
The patient experience. The I mean, people are speaking a lot more about this, and the podcasts have been brilliant around this. So if you go on, for example, Rachel Morris's podcast, "You're Not a Frog," she's often interviewing people healthcare professionals and doctors who've experienced burnout and their recovery from it. Um, and there's a number of doctors who've written about that now. But I'd also, on the NHS Practitioner Health website, this National Service for Doctors, they've got their annual reports up there, and they always include kind of statements and reports from patients who've gone through the services. I'd encourage looking at any of the podcasts, but start with You're Not a Frog, but also have a look on NHS Practitioner Health.
Fantastic. Samantha asks, have you found much evidence for functional neurological disorder and chronic fatigue syndrome or other conditions that lead to somatization? There we go, I've ruined that word for you, sorry. And the long-term impact that this then has on the organization as well as the person.
Yeah, I mean, absolutely right that these things can develop for a number of reasons, and and overwhelming work pressures can be one of the things that can lead some of these to develop, and there will also there. And I'm also thinking about really important if someone's got those conditions that they're in an organization that's flexible enough to manage them. And I think sometimes our organizations aren't as flexible to be able to use all of the talents of their staff, especially if they've got a disability.
Mm-hmm. Basil asks, is horizontal hierarchy really the best way forward, I guess in particular to burnout?
I mean, that looks like the evidence. So if you look at Prof. West's writing about compassionate leadership, the evidence is that does improve thriving within staff. So it does look that leadership style is better. And of course, that sort of horizontal leadership or compassionate leadership, you're encouraging autonomy and belonging, community, and they're exactly the sort of things that help get those cultures that protect against burnout.
Just a quick one from me. So going back to the quite shocking 33% statistic, obviously allowing for the fact that, as you say, these statistics are real, they're very measurable. We have the 10-year health plan, which I'm sure we're all sick to death of hearing about, even 3 months after it was launched. We've got another 9 years and 9 months still to go. Do you feel like some kind of government intervention is needed? Just putting aside the human aspect of it from a financial point of view, is government intervention at the highest level needed to address this issue?
I think it is, and actually, what's very interesting about this government is that they are saying to increase productivity and growth, we need healthier staff.
Mhm.
And they're saying that generally. They're not just saying that within healthcare. So, you know, they are saying. So I think they do get it, and and I think they also get that within healthcare, that we need our staff healthy and thriving to deliver the best care for patients. And actually, we've got a double benefit of looking after healthcare staff, because if they're thriving, they're doing a better job for their patients and they're getting them better, and then they can help the economy in the way that the government wants to do it. So I think the government do get it, but it is, how do you transfer that into reality? Because we're a number of organisations are distant away from reality with looking after their staff well-being and managing burnout at the moment.
Absolutely. Unless we have any other questions, nothing has popped up. Oh no, sorry. Last second one there from Julia here. My experience is that as a senior clinician, I manage the most complex patients. My stress is exacerbated by not being able to meet patient, parent, carers' expectations. Often they are unrealistic, particularly regarding waiting times.
Yeah.
Patients aren't understanding how their behaviour impacts on the well-being of their clinicians and therefore their care. It's an excellent question.
Yeah, and that's so right. And I there's been a psychiatrist who's written about this recently, and her paper was called "The Impossibility of Working in the NHS," and she picks up exactly that issue of the expectations are so high. I think she used the phrase "everything for everyone for free now," and yet services are incredibly stretched, finances are stretched, waiting lists are very long, and that leaves the clinician in the middle feeling as if they are failing.
Mm,
And sometimes, indeed, the organizations can push that down onto us and feel as if it's not an organizational problem, which it clearly is, but it's a clinician problem. And that is making it very, very difficult for clinicians at the moment, and is a key source of burnout, I think.
absolutely. Well, let's move on to the next slide, if that's okay.
Oh, yes, of course.
Right. So just as a little bit of kind of self-promotional aspect, we will be presenting another webinar in November, this time on the role of staff training in meeting CQC's well-led criteria. We'll be sending out some links through the same means that we did previously, so please do keep an eye out for that. That's Thursday the 20th of November, similarly from 12:30. But if we go to the next slide, if you do have any questions, Richard is eminently contactable. His email and LinkedIn information there if you want to take a quick screenshot or jot it down, or if you would like, we can send you this deck after the webinar. And similarly, if you want to get in touch with a designated medical or healthcare today for anything, we are here. And please do join Designated's private practice WhatsApp group, or contact Healthcare Today with any stories, features, interviews, or any questions that you have. We're always very happy to talk about what's directly affecting healthcare professionals. Well, we will be doing that into the future. Patient safety and professional healthcare well-being is absolutely paramount to what we're doing. So we'd love to hear from you. And that's it. Thank you very much for joining us. We really appreciate your input, and we hope you have, well, slightly bit of a lunch break, and we will see you again in the future. Take care.
Thank you.